Welcome to Heart about everything lupus, where we discuss everything about lupus. I'm Susie Eagles Flight, and I'm from Lupus South Africa and Andrea's Gift. Today we are going to discuss lupus and nerve pain. Peripheral neuropathy. A medical term for nerve pain is neuropathy. Peripheral means away from the center. It refers to the areas away from the center of the body or a body part. Peripheral neuropathy is nerve damage that impairs of the communication between our central nervous system and the rest of our body. It can affect up to 6% of those living with lupus, causing nerve pain, muscle weakness, paralysis, and many more symptoms. I must say the 6% to me sounds a little bit low. Most of lupus warriors that I have come in contact with does suffer from nerve pain, muscle weakness at some or other time in their journey. Just a note, I've had 2 strokes, so please just bear with me if I do struggle with pronunciation. So get a cup of nice hot coffee or tea, put your earphones in, sit in a relaxing chair, and let the two of us discuss lupus. Lupus and nerve pain, or peripheral neuropathy. Peripheral neuropathy happens when the nerves that are located outside the brain and spinal cord, peripheral nerves, are damaged, or as my pain doctor says, irritated or inflamed. This condition often causes weakness, numbness, and pain, usually in the hands and feet. It can also affect other areas of the body, functions including digestion and urination. So first of all, I think explaining exactly what it's like and not a medical term on a page is telling you that the pain feels as if it's in the body, in that bone, and it's not in the bone. It feels like it's a bone pain, and it's also tingling, burning, shooting pain in your hands and feet and the legs sometimes. It comes from the hip down in the leg, just the hips paining. Sometimes these nerves in the hip pain so much that you cannot sleep. That's all nerve pain. And then also, it affects your digestion because it's full of nerves everywhere. So you struggle with constipation. Other times it's bloating, all those things. Just a note, please take a probiotic on a regular basis because we don't have the cultures and the digestive enzymes because of the drugs we take. Then urination, all those muscle spasming, loosening the muscles, all is used during urination. And if your nerves are irritated, damaged, or inflamed, that it fixes it. It's almost if that pain when you try to urinate and you can't because that muscle doesn't want to release, it's all nerve pain. Yes, and another thing is with lupus, most of us struggle with pelvic muscle spasms. Those muscles spasm. And we don't know that they spasm or they stay in spasm because we don't necessarily feel it. The only time when we feel it, it's when it becomes terrible and your hips are in serious pain and it doesn't stop. That is what, and the nerve pain also is in there. And the only thing that really works, you can take any drug on the planet, it doesn't work. The only thing that works for that is physio and massaging, getting those pelvic muscles. And there's also, you can search on the internet, exercises you can do for those pelvic muscles to release. So, and also it has to do with, you can have pain during sex because of this. So it's something that you need to note. And if you struggle with it, try something, ask your doctor for nerve medication, try the exercises, try a massage. It's going to give you so much less pain because there's a lot of our pain is concentrated in those areas. The nervous system is by far the most complex part of the human body, and lupus can significantly affect it at almost any level. causing symptoms from brain fog to skin pain and from muscle weakness and even nerves controlling your heart rate. You know that skin sensitivity? It's nerve pain. So, what is peripheral neuropathy for those living with lupus? Let us begin a brief overview of the nervous system. I've explained how it really feels, and now we're going to see how it works. The central nervous system consists of your brain and your spinal cord. The center where we coordinate, regulate, interpret, and ultimately control most of our bodily functions, and occasionally some thinking. The CNS, central nervous system, takes the signals that come from all over the body, skin, eyes, ears, internal organs, and other senses, interprets them, and then sends messages back to the body so that the body can move or react appropriately. Our peripheral nervous system, PNS, consists of all the nerves outside the brain and spinal cord, and as such allows the CNS to sense, communicate with the rest of the body and the outside world. So the peripheral nervous system has two main parts: the somatic nervous system, SNS, and the autonomic nervous system. The somatic nervous system is divided into motor, movement, and sensory systems. As such, it's responsible for most of our voluntary muscle movement, like walking, talking, and facial inspection, and processing external stimuli such as the five senses, as well as other senses such as motion, position, and equilibrium. So the somatic nervous system is motor and sensory systems. That's voluntary moving. All the voluntary moves and thinking, everything you do, that is somatic nervous system. The autonomic nervous system does most of its work behind the scene without our ability or control. It regulates the organs that tend to run on their own without our conscious effort, such as our intestine, heart, bladder, and lungs. It just works on its own. When an individual has peripheral neuropathy, these somatic and autonomic functions may become impaired. This happens during or after an illness, infection, trauma, or injury, which lupus is almost all of those. An individual may feel excruciating pain or experience tingling or numbness in parts of their body. They may be unable to maintain their balance or control their bowels or bladder. Those with systemic lupus erythematosus are more prone to develop peripheral neuropathy due to the activity of SLE. So, what your lupus is affecting within your body. The inflammation that can occur throughout the body and or secondary health conditions from overlap diseases. So we all know, what does lupus do? It causes inflammation and infection, or the infection actually comes with medication. So it causes inflammation. And then other health conditions that is there because of the lupus. So your Sjogren's, Raynaud's, and other diseases as well. There's quite, we get skin rashes, the photosensitivity, all those are connected to lupus and can be part of the peripheral neuropathy problems. Now, classifying peripheral neuropathy. According to the National Institute of Health, NIH, there are more than 100 neuropathies. For ease of classification, they have broken down into 3 groups depending on which type of nerves are affected: the motor nerves, the sensory, and the autonomic nerves. Motor nerves assist with our ability to walk around the block, grab something, um, or speak about how we feel. Sensory nerves allow us to feel the pain of a paper cut. Ouch. Feel the cold and the heat. So, sensory is the feeling. Motor nerves are the ability to do something. Sensory is the feeling, and autonomic is the ones we cannot control. They just do it by themselves. If an individual experiences peripheral neuropathy in just one nerve, they have mononeuropathy. If more than one nerve is affected, it's polyneuropathy. But usually we don't ever just have one nerve, it's also always polyneuropathy. What are the symptoms of peripheral neuropathy? The Mayo Clinic and the National Institute of Health list the following common symptoms of neuropathy: feeling off balance, uncoordinated, and losing a sense of position and falling. Now, sometimes it's vertigo and sometimes it's peripheral neuropathy. That where you cannot stand and suddenly fall happens to all of us, and it is one of the symptoms of peripheral neuropathy. Tingling and buzzing, or pins and needles feeling in the hands or feet. Burning is also one that I've realized, because I know that burning under our feet, it feels like your feet are actually on fire and it's got fever, nerve pain. Muscle twitches, spasms, or cramping. I mean, we all feel that. Weakness in arms, hands, legs, and feet. Sharp shooting, burning pain that may start at the fingers or toe or spread towards the torso. The inability to distinguish from hot or cold, or a sensitivity or hot or cold. I have the sensitivity, cannot bath in the hot water I used to. The inability to feel pain, vibrations, or touch. You'll see that there's spaces on your body that if you touch it, it feels like you aren't doing anything to it. We have patches of those. Pain during normal activities that should not cause pain. Loss of reflexes, excessive sweating. Now you must add this: a woman over 45 with menopause and on lupus drugs, which also causes excessive sweating, and on peripheral neuropathy too. That's 3 times the sweat. The inability to swallow or eat. Now, I've recently just spoken about it. Someone has asked me, is that remember the esophagus can get inflammation and can be affected by lupus too. It also affects the nerves. And then that's when you struggle to swallow. It feels like something is strapped inside, or your food doesn't want to go down, or it feels like there's something in your throat, but you haven't eaten anything and it stays there for the whole day. All to do with peripheral neuropathy and lupus causing inflammation is in the esophagus. And digestive problems. Yes, all of us have digestive problems with the reaction of the intestines. Um, it's a problem because it can have infection, or it can be with peripheral neuropathy causing our digestive system to work properly. That's why we must eat correctly, because the moment you start eating trash, is what I call takeaways, food, your body takes more energy to digest that food, because it's so unhealthy, and then the digestion problems become even worse. And that is why we have to look after our gut very well. And then also take a probiotic every day, and drink lots of water. And yeah, it's something that you just can't do. And I do a parasitic cleanse once or twice a year, where you take a tablets. You can buy them Amazon, or from the health and wellness, and it stops any parasite that may be growing in your digestive system, and then creating holes in the membranes. Then changes in blood pressure that cause dizziness or lightheadedness. You can imagine that if a nerve is damaged, the blood will struggle to go through the veins. because the nerves are given the ability to go there. So that area then has a loss of blood flow. So obviously, it's going to cause lower blood pressure. And then if you stand up, you're dizzy, or even if you just lay down and dizzy, it's all caused by peripheral neuropathy. Then, what causes peripheral neuropathy? Peripheral neuropathy has many causes. The Cleveland Clinic lists the following most common triggers of peripheral neuropathy: diabetes, we all know that; trauma from injuries and accidents; autoimmune diseases like Sjorgensen's, lupus, and rheumatoid arthritis; infections such as the Epstein-Barr virus, herpes, and Lyme disease; medications or toxins such as anti-seizure medication, chemotherapy, and radiations; vascular disorders such as vasculitis, and it's one of our friends that comes with lupus; alcoholism; vitamin deficiency with E, B1, B6, B12, and niacin. Niacin is, I think it's vitamin B3. Yes, it's vitamin B3, and it is the vitamin that helps with blood flow. And then genetic disorders. Remember, you take vitamins when your doctor has told you that you have a deficiency and he has prescribed a vitamin B6 or B12. B1 and B3 is not necessarily boosting, so B6 and B12 is very important. That you should include in your diet and only take if your doctor prescribes it. Is peripheral neuropathy diagnosed? A neurologist typically diagnoses and treats peripheral neuropathy. They should work closely with an individual's healthcare team, especially if the individual has lupus. Now, in the current years, doctors like rheumatologists have a broad spectrum of knowledge on neuropathy and nerves, so they treat nerve pain and issues if we should have them. But sometimes your REMI would ask for a neuroconsult because there's more things that have to be looked at. In 1999, the American College of Rheumatologists recommended guidelines of diagnosing neuropsychiatric lupus. Neuropsychiatric lupus, NPSLE, represents conditions that affect the central nervous system, the peripheral nervous system, in people with lupus. These conditions can include everything from anxiety, brain fog, and nerve damage associated with peripheral neuropathy. The ACL guidelines include case definitions for 19 neuropsychiatric syndromes of SLE. An individual may be diagnosed with neuropsychiatric lupus if they meet the case definition of neuropsychiatric lupus and meet 3 or more of the ACR criteria. Some of the conditions that case definitions have been developed include anxiety disorders, cognitive dysfunction, such as difficulty focus or remembering, headache, which is migraine and intracranial hypertension, demyelinating syndrome, which occurs when there is damage to the myelin sheet around the nerve, myelopathy, that results when there is severe compression of the spine and ultimately nerve damage, which is caused by inflammation and swelling. A septic meningitis, which can result from inflammation of the membrane that covers the brain and spinal cord. Neurologic syndromes of the peripheral nervous system, including disturbances of the peripheral nerves, sensory motor nerves, or the autonomic nerves. So, what we did now is some of the case definitions of neuropsychiatric lupus. Now, the NHS also say that the following can help your doctor to diagnose and treat your peripheral neuropathy. So it's a health assessment, number one, which is assessment from your whole history. Okay, so lab tests, which is organ functions, your kidney and liver, vitamin levels, the presence of abnormal protein levels and immune cells, so that's your antibodies, infections, and other abnormalities. A physical exam where the doctor checks all your autonomic and your reactions. A neurologic exam, which is checked for a degree of nerve damage and neuropathic disorders. Genetic tests, a psychological test, neuropathology test, which is they check on a biopsy of a sensory nerve in your leg, what the nerve looks like. Autonomic testing, that is your ability to, for example, the ability to sweat. Radiology, imaging tests, including an MRI or a CT scan, muscle and nerve ultrasounds, and a spinal tap, which may show antibodies and B cell activation. Now we come to treatment. The first one is the OTC, over-the-counter medication such as ibuprofen, naproxen, and aspirin. Then we have glucocorticoids, which is your prednisone. We have immunosuppressants such as cyclosporin and azathioprine. Monoclonal antibodies such as rituximab and serotonin norepinephrine reuptake inhibitors, which is short SNRIs, which is a class of, which we'll call it normally antidepressants, such as duloxetine hydrochloride, which is called Cymbalta. Many a time doctors do add Cymbalta as one of the, together with Lyrica and Neurontin, as treatment for nerve pain and chronic pain. But in drug classes, they belong to different classifications. Anti-seizure therapy, including gabapentin, pregabalin, topiramate, and lamotrigine. So gabapentin is Neurontin, which is an older nerve pain anti-seizure medication. Pregabalin, which is not really the new kid on the block, but which is the newest, which is Lyrica. Most doctors use Lyrica and Cymbalta for nerve pain. Then we also have the seventh one, carbamazepine, which is Tegretol, Tegretol is used for seizures, nerve pain, and bipolar disorder. And then local anesthetics, that's like lidocaine, patches, and those. And then we also have narcotics, which includes opioids. Number 10 is braces and splints. It works very well because of nerve pain if you struggle to walk or struggle to use your hands. Modifying activity. This might include exercises or even just learning how to move in a different way so the affected nerves are not aggravated. But most of us, adapt in our own little way on to see what is better. And then surgery. There are sometimes surgery that they, operate on pinched nerves to relieve pain. TENS, which is transcutaneous electrical nerve stimulation. Um, that's also used for diabetic neuropathies and to relieve pain. That's almost like impulse machine. You put a little cover on your skin, and then the little machine sends impulses to it. I have found that that is also um, a huge help, but it takes time and long to work with that. Then we have acupuncture. That is one of the best ways naturally to treat nerve pain by far. Massage therapy, that is the one I usually choose and work with. And I must tell you, there's no pill on this earth that can relieve nerve pain like a massage can. I think my husband, my daughter, are, the best there is. Then also herbal medications. Now, herbal medications is always a go-to before you go with, science medication, stuff like that. That's also, you do get, for example, you get holy basil, which is a herb for anxiety, muscle relief, for sleeping. It does help a lot, and it's a little bit expensive in South Africa, but it's an option. Managing the effects of peripheral neuropathy, CBT. Um, it's cognitive behavioral therapy, can help an individual manage their symptoms, especially if they are already trying to manage their symptoms of a chronic illness such as lupus. Now, it includes talk therapy and also include incorporating other management tools that benefit emotional well-being. For example, talk therapy, talking to somebody about what you're going through and the pain and what it is and what it's affecting. Um, the other thing is by looking at, okay, this is what my nerve pain feels like. What am I going to do to relieve that pain instead of just lying down and crying? I know we all do that sometimes, and that's fine. It's okay not to be okay. Just as an example now. Um, so, what am I going to do to relieve that pain? What am I going to? Am I going to take my medication? Am I going to go for acupuncture, massage therapy? Am I going to go use heat? Epsom salt bath is also like a miracle cure. Really, it helps a lot. So that's what cognitive behavioral therapy is, and that's why it helps for nerve pain. And if you have fibromyalgia with lupus, this that we're explaining here is like the manna from heaven for you. Then also, other tools may include practicing Tai Chi, yoga, mindful meditation, journaling, deep breathing, and relaxation exercises, and other practices that help managing your stress. I have recently been starting to do that deep breathing exercises. I've been journaling and a lot of other things as well. But specifically breathing exercises, and it has helped me a lot with my sleep issues at night because of nerve pain or pain or whatever. Then number 4, an individual's support system can be invaluable resource of strength and stability when an individual feels down. So your friends can help you, your family can help you, pick you up when things are too much for you. Delegate your responsibilities so that you are lighter. All those things are very um, important. But then also, the one thing that I want to say, an accountability part. Somebody that knows what medication you're on, what you're taking, what have you taken. And then when you get to a pain, and we all get there, where the pain is just unbearable, then that person must decide. My daughter, because she's with me continuously, she's that person for me. And also accountability with pain pills. We need to be responsible with our taking of pain pills. And although I am a medical professional, I still say, I'm responsible, and Jade must know what I take and when I take it so that she can know when I've done something wrong. And then also, um, it's very, very important to have that accountability partner. And also, like I named, if you have to make decisions and you're just in so much pain, that person can make the decision. Okay, let's do this or let's try this. Very important. Then, number 5, it's important for an individual experiencing the symptoms of peripheral neuropathy and or lupus to be honest with themselves and others about how they are feeling and what they need emotionally. Now, yeah, I'm preaching to me because um, I always downplay my symptoms. I always feel guilty if I'm not doing okay, and I will never say emotionally I'm not doing okay, and the pain must be hectic before I take something, before I say something, and that is the wrongest thing you can do. Also, mentally, I mean, it's horrible that we get um, taught all our lives to you must fake it until you make it. You must always be okay. Nobody must know what's going on. You must just have this face and look okay. And that's the one thing that lupus has taught me. It's not. It's not. You must say how you're feeling. You cannot expect somebody to help you with anything if you're not honest about what you're going through. Number 6, getting rest and sleep is also important in managing and coping with the effects of peripheral neuropathy. Now, don't try to think you're the greatest or you're the best and you don't take sleeping pill and they are addicted and you don't ask your doctor about anything. This is the wrongest decision you can make in your life and you will suffer because of it. You must ask your doctor for something to sleep. You must do other things to help you to sleep. Like, for example, mine is dark room, blind closed, um, phone away. I have the Bluetooth earrings for earphones for the TV. I use those with something boring on in the background, music, whatever you think. And, create a sleep environment. Also, don't take coffee late at night. I used to, and I now take rooibos tea, but I can't say that it's really made a difference in my sleeping pattern, but for others it will. We are all different. And especially if you have pain, it's very difficult to fall asleep like 15 minutes or whenever your sleep medication kicks in. You have to be in a point where you're lying okay and the pain is a little okay, so you'll be able to sleep. So that's why um, other techniques of pain management, your pain medication, your sleep medication, all those things are important. And remember the Z drugs, Zolpidem, and all those only work for a certain period of time and mostly don't work for lupus patients. So usually doctors give us trazodone or triptyline, and then some order also add a calming tablet to calm you down. All those types of things. You have to have something in place. If you're not sleeping and you don't have that in place, it's your fault. Number 7, maintaining a healthy diet and drinking plenty of water throughout. I cannot stress the fact every time I do a podcast or on camera or video or anything, I cannot stress the fact of healthy diet. A healthy diet, the Mediterranean diet, the anti-inflammatory diet. I've done a video and a podcast on diet. Please, please, please change your diet. You will be amazed of the difference it does for you. They heard him say, "Be my honey and I'll be your bumblebee." In conclusion, working closely with a doctor or medical team is very important if you have neuropathy so you can receive the best treatment for you. Make sure you are treated holistically, body, mind, because the only way that you will really get some relief is if from neuropathy is if you treat your whole body. You don't have to suffer with the debilitating effects from neuropathy. There are ways to improve your quality of life. That concludes this podcast. Please review it on the platform you are listening on. Leave a comment below on topics you would like us to talk about. If you enjoyed this podcast, please hit the like button below. Follow us on Facebook and Instagram and TikTok, and subscribe to our YouTube channel. Andrea's Gift, Twins and Teen, Lupus South Africa, and Susie Eagles Flight. Thank you for listening, and remember, giving up is not an option. Bye.